Hey, with Dr. Alex Earl. We're here at Pure Plastic Surgery, and we are going to go over some plastic surgery topics and, of course, answer all of your questions, plastic surgery related questions from head to toe. You know it's all coming from a reliable source, which is me, a double board certified plastic surgeon. All right? So, today, we're kicking it a little bit old school because we have a surprise guest there behind the camera.
Hey!
Those of you who have been following me for a long time may recognize that voice. He used to be here for all our lives, when we started Pure for several years after that. So in honor of having Tamer back here for our live, we're going to kick it old school. We're going to go with one of my favorite subjects, okay?
All right.
So that is BBL Safety, right? So you guys know that I've been talking about this for many, many years, and that I've been practicing ultrasound-guided BBL since September of 2019. I was one of the pioneers in the use of ultrasound for BBL, and I've probably done the most ultrasound-guided BBLs in the U.S. Okay, and so today we're going to talk about a checklist that you should be thinking of when you're choosing a surgeon and a center for your BBL. Okay, because I'm going to ask the first question, which is very, very obvious, right? The first question that is obvious is, would you rather have a safe BBL or an unsafe BBL, right? And of course, everyone's going to say, I'd rather have a safe BBL, right?
Mm-hmm.
I'd rather go home to my family, my kids, and my children. Having a great buttock and hips is not worth dying for, right? So certainly everyone answers that question very easily. I'd rather have a safe BBL. Okay. Great, but the next question is not as easy, right? What's the next question? Well, how do you know you're having a safe BBL, right? Have you asked yourself that question? Like, how do I know that I'm having a safe BBL? All right, well, that's what today's all about. I'm going to give you a checklist that you can take a picture now, take a screenshot, okay, so that you have this list with you, so that you know as you go through the different prompts, checking everything out, that you have a chance or a much higher chance that your BBL is going to be a safe BBL, okay? All right, so the first thing I did is that I broke it down into two things, right? There are, of course, surgeon-related factors and center-related factors. So who's doing your surgery and where you're having your surgery done, right? Those are the two biggest factors there that go into, the safety of your BBL, all right? Some may say, well, what about the surgery itself? Isn't a BBL just in and of itself more dangerous than any other cosmetic procedure out there, like social media likes to say? Well, no. Actually, it's not about the procedure itself. It's about who's doing the procedure, how they're doing it, and where it's being done. Because if you have the right person doing the procedure, doing it in the right way, in the right place, it can actually be a very safe surgery. And so those numbers that were thrown out in the past, where they used to say that a BBL, the mortality rate for BBL was 1 in 3,000, that is no longer true if you're going to the right surgeon who does it the right way in the right place, okay? However, if you go to the wrong surgeon doing it the wrong way in the wrong place, then yeah, it's still going to be 1 in 3,000, okay? But if you go to the right surgeon doing it the right way in the right place, then it's going to be anywhere from 1 in 25,000 to even potentially 1 in 50,000 based on the latest data, okay? And just to put things in perspective, the mortality rate for a tummy tuck is approximately 1 in 14,000, okay? And that's a very standardized, very well accepted procedure, all right? So BBL can be certainly as safe, if not safer, than a tummy tuck when it's done the right way, okay? So let's get into that. All right, so when you're looking at your surgeon, one of the first things you want to check, of course, is, we're always going to talk about their education and their training, okay? And their training is important because depending on their training, it depends whether they are actually board certified, all right? So one of the first things you want to check is your surgeon board certified? But not only that, is your surgeon board certified in the specialty of the procedure that you're going to get done, right? So it doesn't help me at all if I'm getting a cardiac surgery and my surgeon is board certified in pediatrics, right? Or an OB-GYN. No, all right? Would you get a heart surgery from a gynecologist? Duh, the answer is of course no. So why are you getting a BBL from someone who's not a plastic surgeon? like a dentist or a gynecologist, right? Why are you doing that? It makes no sense. So you want to make sure that your surgeon has board certified by the American Board of Plastic Surgery. That's the board that you want to look at. All right, so that's your first check. And this one is very easy to check because all you have to do is go to Google. You Google the American Board of Plastic Surgery. That's going to take you to their website. And there's going to be a little link there for patients that says verification. And then you're going to put the surgeon's name, and it's going to pop out, and it's going to tell you whether they're certified or not. If you're going to search me up, remember that even though I go by Alex Earl, that my first name is Steven. All right, guys, don't forget, because we get this all the time. We're like, I looked up Alex Earl, he's not there. No, look for Steven A. Earl or Steven Alexander Earl, and you'll see there that I'm board certified by the American Board of Plastic Surgery. All right, so that was pretty easy to check. The next one, of course, is experience. So how many BBLs has this surgeon done? Now, there have been multiple studies out there that have shown that surgeons with little to no experience in this procedure have higher complication rates, including those complications, those deadly complications of fat embolism and death, okay? So you don't want to go to the guy that's done less than 50 BBLs. When you look at that study, you see that most of the complications were done by surgeons who had done less than 50 BBLs, okay? So you want to go to the guy who's done, at the very least, more than 50 BBLs in their career, but of course, the more experience, the better. So for example, I've probably done now close to 3,000 BBLs, and I've done, and of those, over 2,000 have been under ultrasound guidance and imaging, okay? So then you check for the experience, right? In my case, I've done over 3,000 BBLs, okay? All right, next, reputation, right? You go, you search online, you search Google, you search the social media, you get into your Facebook groups, all right? You search all these areas and you look for the surgeon's reputation. And the question you're gonna ask there is not, is the surgeon cool? Does the surgeon have, the best before and afters? The question you wanna ask when you're talking about this in particular is, does the surgeon have a reputation for putting patient safety first? Okay? That's the question that you wanna ask, okay? And for example, for me, I invite you to do this. You can ask around, go to the groups, go wherever you want to go, search, and ask, Dr. Alex Earl and safety, and you'll see that we have a stellar reputation for safety here at Pure Plastic Surgery. All right. The next thing you want to look at is the complication rate. What is that particular surgeon's complication rate with this particular procedure? We're talking about the BBL, right? You want to get specific. So that surgeon's complication rate with BBL surgery, all right? Now, this is going to be tough because a lot of surgeons don't put out their numbers out there, okay? But I'm proud of what we do here, and I do. So I put out my numbers every single December. It's the last live of every single year. I put out my BBL stats. So if you go to my Instagram and you scroll down over the years to the last live in December, okay? You can do that for the past 4 years at least. You're gonna see that I'm gonna have a live there regarding my BBL stats, okay? And there you're gonna see all the stats in terms of complications. I'm gonna talk about infection rates. I'm gonna talk about, revision rates. I'm gonna talk about fat embolism, which has always been 0, death, which has always been 0. Okay, I'm gonna talk about all my complications rate. One of the things that we're super proud of is that our infection rate for BBL has gone considerably down over the years. When I first started about 5 years ago, it used to be about 6%. The national average is about 10%, so it was already lower than the national average. But I've been able to get that down to less than 2%. It's about a 1-point-something% infection complication rate of BBLs here with me at Pure Plastic Surgery. So we have to check for low complication rates. Now, here's the one thing that I want to make sure you understand though. Are we checking for 0 complication rates? No, right? There's no way that you can have a 0% complication rate, right? Like I always say, the only way to have a 0% complication rate is to not do surgery. In the same way that the only way that you have a 0% chance of crashing your car is to not drive, right? Every time you get behind that wheel, there's a chance you're gonna crash, okay? So there's going to be a complication rate associated with surgery. It's never going to be 0%. But you want to keep it as low as possible. Okay? All right, good. The next one is really important and very easy to verify. And in fact, in Florida, it's now the law because of me and a few other people, because of us, the pioneers in ultrasound-guided imaging for BBL transfer. But you definitely want to make sure that your surgeon is using an ultrasound. This is now the law in Florida and in New York. So Florida was first, and now New York State has made it law, and I am certain that multiple other states are going to follow. I'm pretty sure the next state is probably going to be California, okay? But this is now the law here in Florida, and I don't care where your surgeon is practicing, whether it's in the US, a different state, in a different country, in Colombia, Dominican Republic, wherever you're going to get your BBL, they should be using ultrasound guidance when placing the fat. This should now be standard of care. If your surgeon's not using an ultrasound, then this is one of the biggest ones. This is like the one that like 100% needs to be on that checklist. You got to get a check here. If there's no check there, then the rest of it is almost irrelevant.
And how do you know if they're using it?
They got to tell you. For example, me, of course, not only do I tell you, but you've seen me do it. I've done it live. You've seen me do it on the videos. Not only that, we're a teaching center here, so you've seen our videos where members from the WAGs, the World Association of Gluteal Surgeons, come to us to learn how to do this procedure. So one of the things that you can do in order to check that, if you don't trust your surgeon, they say they do it, but you don't trust them, is that you can go to the WAGs website, so the World Association of Gluteal Surgeons, and you can ask there if that particular surgeon is a WAGs member. All right, so all WAGs members use ultrasound guidance for the BBLs. Okay, and WAGs, the first word of WAGs is world, right? So I'm not talking about just the U.S. We're talking about the U.S., Canada, Colombia, Brazil, Europe. So we have Spain. Like we have members from all over the world there. Okay. So that is one thing you can check, but yes, certainly you want to make sure that your surgeon is using the ultrasound. Now, if they're a teaching center, we teach other surgeons how to do this here. Okay, all right, and then that takes me to that next one, right? So that's a nice little segue to that next one. So thank you for that question. You wanna check to see if your surgeon is a WAGs member, because if they are, then that means that they're using the ultrasound and they consider patient safety for this particular procedure, the BBL, very, very highly. Okay. Now, whereas I'm not gonna, whereas here I'm gonna say this: you need this 100%. I'm not gonna say okay, they 100% needs to be a WAGs member. I think it's great. It would be very awesome. It'd be nice. Okay. I'm not gonna tell you they all need to be WAGs members. No. All right. But this one here, use of the ultrasound, that's 100% it needs to happen. Okay? All right. So that kind of tells you about the surgeons. All right. Well, what about the center? Where is this surgery being performed? Okay. And so the center falls into two categories that you have to look up. One is reputation. Okay. Have there been BBL deaths at that center? Okay. And why it might be hard to find it for any and all centers. There are some centers that are very well known to have had multiple deaths, okay? And people still go there, right? So you want to look up their reputation, okay? And then the next thing, of course, which is going to be easier for you to verify, is going to be their certification. What is the body that is certifying their ORs, okay? I'll give you the example here in Florida. So in Florida, the most baseline level that you need to have in order to have surgery in the office-based setting is your certification by the Florida Department of Health. If you don't have that, then you can't perform surgery and you're doing surgeries illegally, okay? So at the very least, you have to have the Florida Department of Health, but that's like the bottom rung in the ladder, okay? Next, after that, you have something called Quad ASF, okay? Now, but if you want to be at the highest level of patient safety, where you know that they've gone the extra mile, all right, to do everything that they possibly can to decrease the complication rates for this procedure, then that OR is going to be certified by what's called JACO, or the Joint Commission. Okay? And they're going to give them basically the golden seal, the JACO golden seal, meaning that you're at the highest level of certification that you can possibly attain. All right? And guess what? Guess what we have here? I'm sure you don't have to guess, right? We always go the extra step. So you can see that there. I'm not just talking, as I say, you got to walk the walk, not just talk the talk. Mm-hmm. So here is our golden seal by the Joint Commission. Okay, we just recertified once again. This is our second golden seal in 2023, which is good for 36 months. So it's good up to 3 years. Okay, so that's our golden seal there, and that's what you want to be checking for. So at the very least, Department of Health, one step above that, Quad ASF, so that's 4 A's SF. And then the highest level is the Joint Commission, that golden seal. Okay? All right, so now say you want to take it to the extreme, right? What is the extreme? Well, the extreme in terms of safety is now this, which we hope that it's going to become the standard of care for this procedure. All right? This is the WAGS safety seal. As you can read there, okay, it's a WAGS the safety seal, okay, certified. All right? Of course, I got certified in 2023. I've been doing this since 2019. All right? If your surgeon has this, then you know a few things. You know that they're a WAGS member. You know that they're using the ultrasound, and you know that they've proven to have low complication rates, and that they're using the ultrasound in the correct way. This is what this means. So WAGS safety seal, BBL safety seal, WAGS certified. All right. So how do you get? So it's not you don't just become a WAGS member and get the safety seal. No. All right. You have to go through quite a few things in order to get that safety seal. Number one, you start off by a written examination that you do in the computer. You got to do a written examination. In this examination, you have to know all about the BBL, all about its history, all about the potential complication rates, and all about the anatomy. All right, because that's really what it's all about. All about the anatomy of the buttocks. Okay, and we want to make sure that you have all of that knowledge. That's step number one. Step number two, you go to a center that teaches the ultrasound-guided gluteal fat transfer course. Here at Pure Plastic Surgery, we're the first center, okay? And we've had multiple courses now. We've had probably over 30 surgeons come through here. And we teach them how to use the ultrasound for imaging for the BBL, okay? But you have to, so that's step number two. Step number two is you got to do the course. That's a live course in person where you have some didactic portion, you have some videos, then you get to watch me or whoever the instructor is do it live on a patient, and then you get to go and use some models to practice how to do it on the model. So that's step two. And then step three, you have to then, of course, start doing it yourself, and you got to get video of how you are doing this procedure. You got to send that video up to us. I'm the president of WAGS, so either me or the vice president or the CEO of WAGS, and then we can evaluate the video. We can make sure that you're doing things the right way, and only then, after you've passed all of that, can you obtain the safety seal. Okay? So that's how you have a verification proof that this surgeon has gone through all the steps to do this procedure safely. Okay? So I would ask if your surgeon, whoever you're planning to go to, if they have the safety seal for BBL safety. Okay? All right, and that just about sums it up. I'm sure that if you're able to hit all of these check marks, then you're going to have a safe surgery. All right? I'm happy to answer any questions.
All right. Let's go. First question is, for your lipo BBL surgeries, do you add J plasma to that?
Right. So J plasma uses what's called RF, or radio frequency energy, and it's used for skin tightening. So, and there's two different devices out there, J plasma and body tight. So they're very, very similar. They both use that same type of energy, that RF energy. And they're both used for the same reason, which is skin tightening. Here at Pure Plastic Surgery, I use the body tight, and that can certainly be added to your procedure. And the other thing that can be added to your procedure to help with the skin tightening is what's called the Vaser, with the V, V-A-S-E-R. And so the Baser, I use here for all of my Lipo360s and BBLs. And the Baser uses a different type of energy, which is an ultrasound energy. Okay, and it uses that energy to help release the fat, and therefore I'm able to remove more fat with less inflammation, less bleeding, and better skin tightening.
Can I add an arm lift to my BBL or my mommy makeover?
So you can add an arm lift to your mommy makeover, but not the BBL. Why is that? Because we have some very specific rules here in Florida. So in Florida, when you're doing a surgery that requires a long incision, for example, the arm lift, then we start to get limited as to how much fat we can remove via liposuction, which is actually only 1 liter or 1,000 cc's. So if you're doing your mommy makeover, that's okay, because we're combining, cutting surgeries, right? We're combining your breast lift or whatever your breast surgery is, your breast lift, your implant, your tummy tuck, and we can add an arm lift to that. However, if you're doing a BBL, and then you try to add on an arm lift, well, now you have a cutting surgery mixed with a liposuction surgery, and so now your limit comes down to 1,000 cc's, which is not going to be enough for an appropriate BBL. So I would not add it to a BBL.
Thank you very much. How do people with melanin fade their lipo scars?
So that's a good question. And so the first things that I recommend is the use of a silicone-based scar cream. The one that we have here is called Silogen. And that you want to start using at 2 weeks post-op, and you want to use that diligently every day, twice a day, for at least the very first 3 months, okay? That's step number 1. Step number 2 is certainly you want to make sure that you keep these incisions away from any sort of UV light. So UV light is the sun, right? So away from the sun or any sort of UV light for 1 year, up to 12 months, okay? Now, if you've done all that and they still remain dark, well, then there's some other options such as lasers or IPL, which is intense pulse light, that can help in terms of trying to reduce the discoloration of the scar.
I've had a BBL, but no drains before. You seem to use drains, and
Yes.
I want to know what the benefit is.
Right. So I like to use drains for my BBL, but it's not absolutely mandatory. Okay. So if someone's completely against the drain for the BBL, then that's okay. We can work around that. But why do I like to use the drain? So I like to use the drain because I think it's overall a lot more controlled. There's less leaking from everywhere, okay? And when the massage therapist does their massage, they can kind of push the fluids towards that drain, and so then it can then come out through the drain into the bulb in a more controlled fashion. It also helps keep that that drainage open for at least 5 days, as opposed to if you just leave the incisions open. Sometimes they close up on their own too quickly, and you don't want them to close too quickly because you don't want that fluid to get trapped. So for all those reasons, I think the drain is advantageous. And so yes, I do use drains for my Lipo360 and BBL, and then we remove that drain when you come in for your follow-up visit on post-op day 5.
Thank you. What is the approximate time frame between sending in photos through the website and a date of surgery with Dr. Earl?
Well, between that and a date of surgery can be anywhere from 1 month to 1 year, depending on when you want your surgery, right? So we have we're pretty liberal here in terms of when you can book your surgery. So we give you up to a year, up to 12 months, okay? And so let's kind of break it down another way. So what's the time frame from when you submit your questionnaire and you get your photos and you get a call from one of our patient care coordinators? That's going to be within 3 business days, okay? So you submit everything, and then our patient care coordinator is going to reach out to you, and then they're going to initiate the conversation. They're going to get to know you. They're going to understand what it is that what you're looking for, like what are your goals and your expectations, and then they're going to also let you know about my recommendations based on your photos and your questionnaire. Okay, and then from then you can place a deposit. Remember that all deposits here at Pure Plastic Surgery are 100% refundable up to within 45 days of surgery. So it's really like little to no risk there. And then once you place your deposit, that is when you can then set a date for your surgery. Okay? So once you place your deposit, we can set that date. And like I said, that date can be anywhere within within 12 months of your inquiry.
Would you recommend for a diabetic to get a BBL?
Sure, a diabetic can get a BBL here's the caveat, as long as it's well controlled, right? You can have an uncontrolled diabetic getting a BBL or any surgery for that matter. But if you have diabetes and it's well controlled, so you're either taking your oral medications, so your metformin, you're taking your injections, your insulin injections, then it's definitely okay to do the surgery. The one thing that we're going to check is what's called your hemoglobin A1C. That actually tells us whether your diabetes is well controlled, and so we want that hemoglobin A1C to be 6.5 or below. That's for most diabetics and type 2 diabetics. For type 1 diabetics, we accept up to 7.5 in terms of that hemoglobin A1C.
Thank you. Following a tummy tuck, is it okay to get more lipo?
Definitely. So I always recommend doing your tummy tuck first. If you're someone that has loose skin or you have weak abdominal muscles or muscle separation, then my recommendation is to do your tummy tuck first. Deal with the weak muscles and the muscle separation. Remove all that loose skin. Make things nice and tight once again, and then come back 3 to 4 months later for your Lipo 360 and BBL.
Thank you very much. Next question is, do you perform high definition Vaser or J-plasma lipo for a male?
Yeah, definitely. Actually, we have a procedure here which we call the pure total definer procedure. All right, and that's geared for men and women, but it's definitely geared for men as well. And that involves high definition liposculpture. Okay, and it does involve skin tightening also with the Vaser and the Body Tight, and also the use of the Morpheus, which is another device that we use that helps with skin tightening called Morpheus 8, which uses a microneedling with RF energy as well. And with that procedure, we're able to define all the muscles. The ones that most men want are the muscles of the abdomen, so we can create or help define that six-pack. We can define the muscles of the chest. We can define the arms, so also in the shoulders, so the deltoid, the biceps, the triceps. We can help define all of these muscles with that procedure. So I highly recommend it.
Thank you. Let's see. Can I get a BBL 10 days after taking morning after pill?
All right, so I wouldn't recommend it. If something happens, you have to take the morning after pill. Ideally, I would wait at least. I would wait about 30 days. That is the most ideal. Okay, you want to avoid any estrogens within 30 days of surgery, and the reason for estrogens, for avoiding estrogens, is that they increase the chance of blood clots. Okay, so that's the whole reasoning behind it. So if you're on oral contraceptives and you take morning after, if you're any sort of estrogen based medication, that increases the potential risk of blood clots, which of course after surgery can cause very major issues like a pulmonary embolism. Okay, so that's why for our patients we want them to avoid all estrogens for 30 days before surgery to 30 days after surgery.
If you are taking, all right, let's see, this GLP-1 medication, do you have to stop medication before BBL surgery?
Definitely, yeah. So the GLP-1 medications are the new weight loss injections, such as the semaglutide, Ozempic, or the Mounjaro. First of all, I think these medications are awesome. I think they're great. I think they revolutionize weight loss, especially here in the U.S. So, definitely recommend them if you're if you're looking to lose some weight. I think they work very, very well, and you don't have to go through a bariatric surgery such as a gastric sleeve or a gastric bypass. But the way that these medications work is they slow down your gastric emptying, and therefore you feel full and you eat less, right? But the issue is that when you go to have surgery under general anesthesia, you need to have an empty stomach, right? So in order for that to happen, then we have to stop these medications at least 2 weeks before surgery. If you can stop at 30 days before surgery, even better. But at least 2 weeks before surgery, you have to stop all the GLP-1 medications.
Thank you. Let's see. Got a lot of questions.
All right.
I got a little time. Maybe we can try to keep you here for another couple hours to get to this.
Let's do a few more minutes.
All right. So if I schedule a surgery with you and meet you, can we add on in our pre-op appointment?
Yeah, certainly. So, sometimes things change. Sometimes things can get added on. And that's why it's so important that we of course talk the day before surgery. So I meet all my patients at least, one day before surgery. And that's when we can of course go over your goals and your expectations. And if we want to add something on, that's the time to do it. If we want to change something, that's the time to do it. But yes, we're going to have ample time to do that.
Thank you very much. How do you feel working on someone with an LP shunt?
Okay, so unfortunately, I'm probably not going to be able to take that patient. Okay, so you have a lumbar peritoneal shunt. I don't know exactly where that shunt is going. I don't know. There's definitely a risk that we can mess with the shunt and create major problems. There's also risks of infection with an LP shunt. So unfortunately, not a candidate for a completely elective procedure in an office-based surgery setting.
Now, what about somebody who's interested in a BBL but has moderate anemia?
It depends on the degree of the anemia. So all of our patients, especially going for lipo 360 BBL, are going to need to have a baseline hemo level of 12 or above. Okay, so 12 or above. If your baseline hemo level is under 12, then we won't be able to do the surgery. We'll have to postpone it. I then recommend that you talk to your primary care doctor and figure out a plan to see if you can get it to 12 or above. Sometimes you need iron supplementation. Sometimes that can be orally or it can be via transfusion. But that is the goal. The goal is to get you to 12 or above before surgery.
Thank you. Is there a list of the surgeons that you've trained so we can see who to go to?
Yeah, there is one, and like I said, we can provide that specific list. But also all the surgeons that we've trained are WAGS members, and so you can go to the WAGS website as well to see your surgeon is a member.
Thank you. We've got time for a couple more questions. Is there a maximum age limit for BBL and why?
So I do have a max age limit for BBL, which is 50, and I can already hear all the groans like, "What, doc? 50 is not old." I understand. I get it. I don't think 50 is old either. I'm 47. I'm almost there. But why do I have this? Okay. Like I said before, I've done over 3,000 BBLs, right? It's not my first rodeo. I've done many, many BBLs. And what I have found in my experience is that patients over 50, they don't do well for a couple of reasons. One is that the recovery is very, very tough on them. Very tough. There's a lot of fluid shifts with their surgery. There's always going to be a certain degree of anemia, and they just don't tolerate it very well. And so the chances that they end up in the hospital setting for hydration because they became dehydrated or for a blood transfusion is higher. Okay. The other thing is the skin quality. Unfortunately, as we get older, the quality of our skin gets worse and worse and worse. Even if you try to, even if you took care of it, like even if you were not a smoker and you never became pregnant or anything like that. But the truth is that life happens, right? And most, women had a pregnancy, at least one. Perhaps there's smoking, perhaps there's some damage, perhaps it's just genetic. But the point is that as you get older, the elasticity of the skin becomes worse and worse and worse, and so then you have poor quality skin and loose skin, and sometimes a whole bunch of stretch marks, and that skin just doesn't do well. And then you do liposuction, and that skin just doesn't bounce back, and it ends up looking lumpy, bumpy, and uneven, and then the patient is not happy, even though I told them all these things before the surgery happened. So that's another reason as well. As you get closer to 50, certainly if you're like between 40 and 50, and if you at that point in time you have loose skin, like I said, I recommend doing that tummy tuck first. Do that tummy tuck first, get rid of all that loose skin, get everything nice and tight, and then do your lipo 360 BBL, and believe me, you're going to be a lot happier. You're going to have that beautiful shape, that beautiful oral curve, that my signature upside down heart. You're going to have a nice, flat, smooth belly if you do it that way.
Thank you. All right, we'll get the last question here.
All right, last one. Here we go.
When you're training a surgeon on safe BBLs, what
Yes.
would you say is the most important tip that you can give them?
So the most important component of the training is when they're watching me doing it live. That's, I think, what makes our course different than any other course out there. I've been to other, I've seen other BBL courses where they're just using some model like on the desk like that, and they're just kind of doing it on the model. And of course, that's helpful, especially if you've never done it, right? Just to get your bearings and understand what's going on. But it's not like watching someone do it like in the operating room live, real time, and me like showing them every single thing that I do step by step, giving them all the tips of how to do this safely. Okay, so that's why I highly recommend this type of courses, and that's really the most important part of the course. So it's not going to be everything else. Everything is important. You want to watch the videos, you want to learn about the anatomy, you want to know the didactics, you want to know the statistics, all this stuff. Yes, it is all important. But the most important part is watching, me or someone like me doing it live in front of them, and that way you can see everything that we do, you can see exactly how we do it, and you can ask questions right there as things come up and have all those questions answered.
Thank you.
All right. Okay, everybody. Well, I hope this was helpful. Please, if you're thinking about doing a BBL, take a screenshot. Okay, so at least you know what you're looking for. All right. Not the only one, but the one that is definitely non-negotiable is this one. Okay. If they're not using ultrasound, I wouldn't go. Period. Point blank. Period. I just wouldn't go. Okay. But you have to check everything else as well. All right. That's about it for today. But I look forward to seeing all of you next week on Hump Day with Dr. Alex Earl. I'll see you then.